cells, which makes all the antibodies that tend to cause a lot of the problems. So it's pretty involved therapy, and they also have to kind of give you a little chemotherapy to, lower your white cells so that these T cells can do their job before your own immune system decides, like, we don't really like what's going on here. So it's very involved, very expensive, and it's only been, a few dozen patients that have been treated, not just with lupus, but with other rheumatic diseases. The results with lupus, and I don't think anything's been going more than a couple years. But these patients have basically done very, very well, and they're off all medication.
And that's where I want to be.
Yes, but no steroids, no CellCept, no hydroxychloroquine. So, but the treatment, depending on which, type of treatment it is, because they use different antibodies, each company has its own little twist on it. And some of them are trying to get away with the chemotherapy. There are some certain side effects that have occurred in the patients with lymphoma and leukemia. They have not tend to be anywhere near as severe in the lupus patients because, with the patients with lymphoma, you're killing a lot of B cells. So they have what they call tumor lysis syndrome, where you get sick with it. But in lupus, you're not really having that much of, cell death. So it looks like it's safer, but we'd like to see, does it work for 10 years or does the lupus come back after 5 years? Because it costs around $500,000 per treatment, depending on the exact way they do it.
So the insurance will cover that?
Well, I don't know. They're covering it for lymphoma. So, if you have a 30-year-old patient with lupus and they're going to be doing fine without any medications, not going in and out of the hospital, not going on dialysis, it might be cost effective. I mean, it's hard to know.
Well, yeah, I mean, the difference is also with the lymphoma patients, it's already FDA approved. And so as part of a trial, no one's going to be paying for it except the companies, right?
Right.
But it's still, it's a pretty, it's a lot of work. You have to be often in the hospital for some period of time and.
Depending on the trial, yeah.
So they don't have any clinical trials for that?
There are trials.
That's
There are
what
trials.
So how can I sign up for that?
Clinicaltrials.gov. And see if there's not
They said
many.
I didn't qualify
So,
because I
yes.
was taking been listed. Is that all the trials or just the one that I tried to do?
I don't
Everyone's
know.
different.
Yeah.
Yeah, each
Oh,
trial is
okay.
different. So you have the exclusion and inclusion criteria.
There must be
Okay.
at least 30 companies looking at
There's
variations
several
of
out
this,
now,
if
because
not
that's kind
more.
of like the hot topic.
I have no one.
Say that again?
I just received a finished my first round of a CAR-NK trial for lupus.
So that's a different type of therapy.
It's a different,
A
it's
little-
a CAR,
it's less
but not
expensive.
T.
It's less
It's
expensive.
less expensive, but for the trial, as a participant, I'm telling you, it's a free and I get compensated. I'm still in the period of they're still monitoring me, which is what I expected. And what else were we gonna say?
How is it going so far? Is it working?
Oh, so far, I think that's what everyone's interested in. I'm off prednisone, I'm off antimalarial, I'm off immunosuppressant.
Oh, wow.
I still feel some symptoms, like I still have a little bit joint pain right now at this very moment, but I don't feel like I need painkillers, any medication.
Yeah, that's where I want to be.
That's the way I want to be.
Yeah, and you may not qualify depending on the trial, because they're looking for a certain type of patient.
Because it has to be safe. So
Yeah, you
you
have to
can't
be-
have an extremely sick person, like I get excluded all the time because of other things that I have. But I keep trying, I'm like, maybe one day I will qualify, but it has to be safe. So that's why everyone can't participate. Back there?
Hi. In my experience or my knowledge, almost 100% of patients with lupus have rheumatoid arthritis.
I wouldn't say 100%.
Well, I'm just saying close to. Most of us have arthritis or joint pain. I apply for clinical trials on a daily basis, and I'm always